चलें, let's start our lecture for today. Today we will be covering the approaches like आज हमारा one of the main content would be the rheumatology. Like this is facial pain, facial weakness is some kind of rheumatology. Other will be problem in hand, rheumatoid arthritis and gout. These are the very common scenarios. All of these five I'm talking about, these are the very common scenario which are coming in the PLAB-2. Then it comes towards the urinary tract infection. There are three scenarios. Two are the UTI are similar. One is the BPH with UTI. That is also very common scenario that's coming. Then it's the urine incontinence. That's a very different approach. Because in the BPH scenario and in urine incontinence, these two approaches in BPH with UTI, urine incontinence and UTI approach will be like together. After that, deranged LFTS. This is again very much common scenarios coming. Analgesic nephropathy, erectile dysfunction, and nosebleed. Analgesic nephropathy is very common scenario. These are the group of scenario which are coming very commonly. Okay, start our today lectures from the facial. There are two scenarios regarding the face. One is facial pain. One is facial weakness. I have put them together because sometimes you get confused because of them. So facial pain is another thing. Facial pain is this scenario is regarding trigeminal neuralgia, and other is with the Bell's palsy, the weakness. Okay, let's start about the first scenario. Is the facial pain. The patient will presenting with what brought you here? I'm having the pain. Okay, you will start taking the history. Let's read just its information. The pain is on the right side of the face. It's sharp. Starts suddenly yesterday while shaving. When you are touching the area, you open your mouth and when you are eating. The pain is there. Always doing this. Took paracetamol, ibuprofen, but no improvement. Normally fit. No, I'm not using any medication. This is the scenario, but this is the information they're not going to give you. These are the questions they're going to ask. Similarly, like any pain station, you will be asking the question regarding the Stupa KRSA. You can remember this with the Socrates. However, why I have put these together, because if I ask you to do the Socrates, you forget about the question. But if you remember, do some effort, because the Odipara and Socrates is almost in half of the your station in your exam. So you need a quick reflexes regarding asking these questions like Stupa KRS, asking all of these questions we have talked about multiple times. I'm going to give you one more clue in today's lecture. I have made this grapes tea and Stupa KRSA. Why? It is because never forget to ask T. Why? When you start, what brought you here today? He will say, okay, I have a facial pain. You always ask a one open-ended question. Tell me more about that. Because it will save your time. He will tell them, yes, actually, doc, I'm having pain when I eat, when I do shaving, and the pain is from the last 5 days or the 10 days, whatever he says, he will save your time. Then you need to complete Stupa KRS or Socrates. You need to just complete it, not ask the question. Just I have done a couple of stations with you guys. I have watched that you repeat a lot of questions. The patient says the question, and when you start you're asking question, you just repeat the question. Then there is not use of asking this open-ended question, because this open-ended question is quite important, because a lot of you people says, and this is very much common, that you say that our we cannot complete the history. Why? Because you repeat and you do not ask this open-ended question. Okay, and after asking Stupa KRS all question, when it is, since how long it is, what is the progression, all of them, then you ask about anything else. Sometimes you miss this as well. Why? That's why I put this A in the end KRS and put this T in the end of grapes. Never forget to ask T and A at end of your this approach. Why? Because it will save your time and it will save you, because sometimes you do not ask the question and you suppose that I have asked whatever, I have chest pain. and you do not ask what more, and it is not telling you I'm having shortness of breath, and you thus by memorizing the scenario you say is the heart attack. So similarly in this patient, every patient you need to ask these two questions. What are these two questions? Tell me more, anything else, okay? And tell me more after grips, and anything else after doing your Socrates or Stupagarus. Then come, okay, in pain scenario, I would just always ask the trauma first. Except like the pain is like coming from the heart, and you know that, then of course the heart attack question should become first. Otherwise, they should make your habit, any pain scenario, ask the trauma first, because otherwise you forget asking. Do you receive any trauma recently? Have you heard, by any chance, have you heard yourself recently on your face? Any question, whatever question you want to ask, but ask the trauma first regarding the DT. Then ask about the dental problem, dental caries, any infection, dental infection. Then the visual problem. Why about the visual problem? It is important because we have like studied the polymyalgia rheumatica. We have studied regarding temporal arthritis, and the visual problem is one of the that sign, because the facial pain and the temporal pain, they are the same. So need to ask about the visual problem, then ask about the neurological problem, then go for systemic inquiry. And systemic inquiry, why I put the systemic inquiry here, because you forget ask any question, you ask about the infection, anything like that, okay? So in this scenario, it is not important. You will not be like deceived by the taking history, because if you forget something, that's not that important. But important in this scenario is the management. Really, they have designed certain scenario to like look for your management plan, and certain scenario to the history. This is actually the management plan. History is quite like very easy in here, okay? Then PMA, Holy Family, Desert-Ollie, all of these questions you will be asking, and you will be asking I is quite important in here. Why? Because it is impacting his life, and you are not asking how it's impacting your life. This will like lose your mark. Okay, you forget to ask about the visual problem. It's okay. You forget to ask about the red flag here, red flag in here, weight loss, red flag. Okay, I forgot to red flag. But asking about the PMA, Holy Family, Disorderly, and whenever person say I'm having the pain, sorry, I forgot to tell you, ask about what have you taken for that? Have you done something for that? He says, yes, I took ibuprofen. For example, if you're not asking this particular scenario, you're not asked, and patient say I'm having pain, when he's going, you in the management is saying, okay, I'm going to prescribe you the ibuprofen and paracetamol. Say, I'm already taken that. I have already taken that, and it's not relieving my symptom. And then it is the disaster, because you are telling the wrong management. This is the basically management scenario. And in this management scenario, you need to ask question, these kind of question. In this question, when I say I'm having facial pain, you are asking all of the question. Have you taken anything for that? He says, yes, I have taken this and that. And does it work? Ask this as well. Does this work? He says, no, it's not working. Okay. So you need to ask this kind of question in this. Then complete PMA, Holy Family, Desert-Ollie, and in PMA, Holy Family, Desert-Ollie, you need to ask all of these questions in here. Allergy, any over-the-counter medication, what he's taking, because the cause of trigeminal neuralgia is not known. So you need to ask all of these questions, even the family history, okay? Then AIs, anything you want to add? I'm repeating because we are meeting after a couple of days. That's why I'm repeating this approach. Then ask about, do you have any idea what's going on? Is there any particular query? You can give you some of its query. Then come toward the OET observation. You need to take observation. CNS. There are 3 to 4 things, 4 to 5 things in observation. Sometimes saturation. You need to take the saturation as well, but general observation are 4. Then you need to do the facial. You need to say this. Would you say in both of these facial examination? I need to do the facial examination. I need to do the examination of facial nerve. You will say that. Okay, facial nerve examination. Everything will be normal, because in this only it is the pain. Facial nerve is normal. So you will say trigeminal and facial nerve. You will say that trigeminal and facial nerve, and the diagnosis is trigeminal neuralgia, and you will say it is actually the irritation of the nerve that is supplying your face. That's why you are having the pain, and the cause of this is unknown, not well known cause of trigeminal neuralgia. Okay, okay. And treatment for this is, what is the management actually? Because we start with management from here, start on the carbamazepine, and this is the dose for 2 weeks. Okay, follow up after 2 weeks. This is the treatment. You will not any other, because we normally we mug up the things and we say, because there is a gabapentin, there is pregabalin, all of these are the same neuroleptic drugs, but here you will only prescribe carbamazepine. uh, Carbamazepine. This is the drug of choice for trigeminal neuralgia. You will prescribe only this, not any other, because they can work in any, because it is the neuroleptic pain. You need to prescribe some neuroleptic medication. But here, the specific carbamazepine is very much specific for trigeminal neuralgia, and you will prescribe this one. And this you can tell about the side effects of the carbamazepine. And then after telling that, never, because this is actually the management scenario regarding this, nothing is more important than telling the management, because in history taking, you will have nothing where you can lose your marks, a lot of marks, like you can not do blunder over in the taking history. But in the management part, this scenario, if fails, it is due to management, not because of history taking. That should be clear in your mind. Okay, lifestyle modification is quite important here, because he's having some problem. You need to tell, because the carbamazepine is going not to work in tomorrow. You are giving the painkiller and the pain is gone. No, it's not like that. It will take, you need to tell your pain will take some time to go. Till then, you need to take care of the certain things. What are these things? If any problem while eating, you should eat soft food, can use straw while drinking, should avoid trigger like and touching your face, shaming, walking in the cold wind. Okay. The patient can ask why the ibuprofen and not working. This is the scenario you should tell this, because the neuroleptic pain generating from your nerves, such kind of medications are not working. Thereby, I'm prescribing you. This is the particular type of medication, which is that this is the carbamazepine. Okay. For the safety netting, it's safety netting like could be any signs of meningitis. Its safety netting could be like any, because this patient is in a lot of pain, any depression, any symptom you're not unable to coping up with, you can come back to us. Okay, so it's safety netting, and you will provide the leaflet as well. Okay, then come the other scenario, similar. This, the facial weakness scenario, is for the management. Facial weakness is for the management. It is not for the history. You are going to take the excellent history. I know that this is the quite easy, but in the facial, both of these scenario, what should be in your mind? The management. I should give the excellent management, the management which is the NH advised management, not the management which I like. Okay. Facial weakness. Avoid doing the surgeries. 26-year-old has presented with some concern. Other information. She has given birth 5 weeks ago. Baby is doing well. Because why baby is written over here? Baby, because it's not written. You need to ask. You need to ask. Otherwise, because any happening, you need to explore any happening. So this is a happening now. She has given birth to a baby. This is a happening. Okay, talk to the patient and address her concern. Patient info, drooping off left-sided of her face. Yeah, let me see if I'm like recording. Yeah, it's recording. It's getting recorded. Patient noticed drooping of the left side of the face. Also has some problem of tasting. Cannot close left eye. Has the foreign body sensation in the left eye. Could not eat breakfast properly, as kept falling from the mouth. Okay. After reading this, its history is important as well. Because why its history is important? Because some very dangerous disease is coming in this zone. What it can be? I just want to ask, what is some danger is coming in this zone, in this scenario? Anybody? You can share your thoughts with me, because if you share, then it's gonna work a lot. What thing I'm asking, why the history take is important? Because a uh, uh, very danger zone disease is coming. Anybody? No, no, it's not post. It's not about that. Uh, it's about stroke. Exactly, it is about stroke. It is about stroke. No, it is exactly about stroke, because you need to rule the stroke. Because why? Because if it is stroke and you have not asked the question about the stroke, then they're gonna fail it, because it's the red flag. It is stroke. Okay. uh Again, you need to, I'm not going to talk about, because it is not stupa, it is tupa, not stupa krs, because it is the weakness. It is the tupa questions, not for pain. It's the tupa a. Okay. Then you will be asking about the dd. Any head trauma, head injury can have this effect as well sometimes. And stroke questions are quite important. You need to ask about the speech, sensory loss. You need to ask all of these questions. Fast questions for the stroke. To exclude the stroke, we ask about fast. This is the mnemonic for that. It is the facial weakness, and facial weakness is there, but you need to ask the rest of the questions. uh, Headache and weight loss, this is the separate question. You should ask this, and you should do the systemic inquiry over here, because the stroke should be in your mind. If you ask question regarding the stroke and you forget any other question, it doesn't matter. But if you are forgetting the other stroke questions, then it's gonna be the real trouble, because it is the red flag. Okay, stroke is the red flag over here. Then you will be asking about all about the PMA Holly family Desartoli. You will be taking the birth history, a little bit of the birth history, because she has given birth to a baby. You will be asking about the baby's well-being over here, because it's the social kind of history you will be taking. And you'll be asking about the family history as well, because uh, uh, it's the Bell's palsy, and Bell's palsy can have the family history. So you need to ask about the family history as well. And definitely you will be asking about the Desartoli. It is quite important over here, because the again, the Bell's palsy is having unknown cause, and the disease is having the unknown causes. You need to rule out PMA Holly family Desartoli completely. Why? Because patient can give you any clue, and you need to ask all of these questions. Then AIs, then OET, cranial nerve examination, facial examination, finding will be given, drooping of. Okay. One thing I forget to write over here, that was the rule in question, because I want to again to let you memorize what are the rule in questions. Rule in questions are actually the disease related questions. Whenever there is some, like, you can ask rule in question before DD. Actually, it is the part of the DD. For example, whenever there is a positive click on a certain disease, you need to ask a many question regarding that disease. That is the rule in question. And here we have not written the rule in questions. The rule in question for the Bell's palsy, for the facial dropping, and for the Bell's palsy. Rule in question. What can be they? What can be the rule in question? All of these questions, like she's having problem with like eating, she's having grittiness in her eye. You need to ask all of these questions. These are the rule in questions for Bell's palsy. Actually, it's not for the Bell's palsy, it's for the facial nerve palsy. Taste question. How is your taste? Taste, gritty eyes, because it's not, it cannot close her eyelid. That's why it has a gritty sensation. And lacrimation is like less. That's why it's having the gritty sensation. So you will ask three questions. Grittiness, one. The other will be drooling of saliva, or while eating anything comes out. And uh, let me write over here for you. Eating, drinking problem. Taste issue. I need not to go like why I'm asking this question. You know, these are all the facial nerve questions you are ruling in, because it's the facial nerve issue. It's not the any-stroke issue. First, we can ask this before, we can ask this later, doesn't matter, but need to ask. That is important, that you should ask. So here, if you ask about the stroke question, first question, and you ask about the rule in questions, the history is like okay. History is okay, then you will be doing PMA Holy Family Desatoli, and after that uh, OET. In the OET you will be again similar like the others, where you will be saying like this. I will be doing the facial, I will be doing the neurological examination, general physical examination. What is the neurological examination, especially the seventh nerve examination. I know you know about how to do that. There are 3 to 4 things when to, what we do in the facial nerves examination, but they are not going to ask you. Finding will be given to you. Drooping of the left side of the face, absent wrinkles. These are the 4 things you generally check. Clench, these are the 4 things they are given. They are already given. They will say this to you. What will be the management? In the management, you will tell this is the Bell's palsy because the cause is not known, and which is the weakness and paralysis of the nerve that supply the muscles of your face. What could be your decision here? You will give prednisolone. For example, this is very common. I think I did this in my mock test. I did not know about the management, because most of us do not know about the management of the facial palsy, this Bell's palsy. Its management is giving the steroid for 10 days. This is typical management of this, giving the steroid for 10 days. If you do not even tell about the dosage, you do not tell about anything, you tell about the time, 10 days prednisolone will be given to you, and after follow-up will be after 3 weeks time. Okay, this is the follow-up time. And lifestyle, again you are again prescribing, telling the patient lifestyle, what lifestyle should be telling. These are the lifestyle. Lubricate your eyes. You will be given some eye drops. This is not the medication, you are giving the lubricant just to lubricate, so that no ulcer can be formed, or is not suffering from any other problem. So if unable to close eye at the bedtime, tape to close your eyes. So these are the things you need to tell. These are the lifestyle modification you need to tell to the patient. When go to outdoor, wear glasses, should not swim. So these, have you seen this? Both of these questions of the face, it requires treatment, it requires lifestyle modifications. So both of them require some lifestyle modification. That should be in your mind. What can be the safety netting if irritation in your eye, change of vision, seek immediate medical advice. Okay, these are the, I have copied this from the NH side, because they can ask you, will I recover soon? But you need to, if it's not asking, you can tell by yourself. Keep in mind, you need to keep the patience, because sometime your symptom will not go away in after 2 week time. However, you need to take this, and if your symptoms are subsiding, however, you can have some residual effect that will wean by and by. You need to tell that. Okay. because the patient become anxious after that, because for example they are not getting exactly well as they were, so they become anxious. You need to counsel this as well to the patient. Okay, this is actually the counseling you going to tell, because this kind of disease, it's normal for this disease. uh, it will take a bit longer. It can take up to like 6 months, I think. How much they have written? 9 months even after, to have a complete recovery. You need to counsel this to the patient. This is, I have copied this from the NHS side. So they'll ask, is stroke? No, it's very highly. It is stroke is very stroke is highly unlikely. Stroke usually come with some weakness, and you know that. So these two are the separate approaches, facial approach, and these are the very much common stations. You can see in 3 to 4 days scenario, one of them will be there. Okay. The other is, these are the two scenarios, and both are the important one. Then it is the rheumatology scenario, and this is again the scenario we're going. This is the Raynaud scenario. This is again very much important scenario which we are going to discuss now. Hand problem. The patient will come, I'm having the hand problem. And you need to explore what hand problem. Okay, tell me more. What other you will say? Tell me more. Then he's gonna say these things to you. My fingers becoming cold, experience discomfort in hand, happening since 18. That's chronic because it's not 24, and it's smoking cigarettes and all that. And you need in this scenario, this is history taking, and again the management. History taking and management. In this, management is quite important. Again, why I'm telling you in this way, because the management of I can reassure you, because 90% of the people who cannot make the PLAB-2 exam, it is for the management, not for the history taking. You all of you in the end, before going to the exam, you are going to be very much able to take very good history. But regarding the management, because we think in our mind the management is just what is in my mind. No, it is not what is in your mind. It is what you need to educate the patient. That is the management, not what is in your mind. So patient come with hand problem. You need to again take the first question should be again trauma. I ask whenever there is say some hand, they say having the I'm having the discomfort in the hand, ask about trauma, because the trauma can have any nerve injury, anything like that. It can cause this problem. Ask about the trauma first, then ask about the systemic. Then, because it's the systemic kind of scenario, you need to ask of all of the systemic questions. For example, trauma, rheumatoid arthritis, primary Raynaud, systemic sclerosis, then the systemic inquiry. And these are the questions you need to ask about how you can ask this question. After trauma, you need to ask any hand stiffness, any stiffness of the body in the morning, rheumatoid arthritis, primary Raynaud is one of your diagnoses that actually is diagnosis. Then the systemic sclerosis, any problem, any skin issue, because in the systemic sclerosis, the skin become in a particular way. You can ask any skin problem, any skin rash, because you are ruling out the SLE as well. Any pain, any joint pain. Actually, in here, you need to rule out. What is what should I say? The rheumatology, all of the rheumatology. You need to go through a lot of rheumatology scenarios. Okay, not DD is rheumatology. In here, trauma and rheumatology. Different diseases of rheumatology are the DD here, because the Raynaud, one is the primary Raynaud, one is the secondary Raynaud. Secondary Raynaud is associated with many other diseases, like it could be like with rheumatoid arthritis, it could be especially systemic sclerosis and SLE are very much linked to Raynaud. Okay. Then ask a general systemic inquiry, weight loss, all of them. And then ask about the rule-in question. What are the rule-in questions? For example, and you can ask these rule-in questions before starting this DD, like pain, any numbness, pin and needles, difficulty moving the affected area, like its weakness, and any such kind of problem or weakness, or any pain in your ear, nose, because it says that sometimes it can radiate to these areas. So these are the rule-in questions. You can ask before starting this, or you can ask after this. But you should ask these questions, because these questions will be telling you that it is the Raynaud. So these are actually the Raynaud question, but you are not getting any of them there. This is the primary Raynaud, whose cause is not known. Okay. Then asking about the PMA Holy Family Desatoli. And in here, if you are not asking about the impact on your life, this is a disaster. For example, why? Because she is having a trouble from like how many time, like 3 to 4 years or 5 years, and you are not asking about this, how this is impacting your life. So this is the most important question over here, is the impact on your life. I is very much important here, how this is affecting your life. This is again very much important. You will complete PMA Holy Family Desatoli. You will ask about the family history. You will ask about the occupation, because occupation is important, because if she's the typist, you need to involve the occupational therapist. You're not asked about the occupational history, you cannot manage it. Then you're not asking about the impact of life. You are not, this question is impact of life on your life is actually your IPS. This is IPS question. How it is impacting your life. Can you please tell me how it's impacting your life? I can see that you might be in a very troublesome situation. So this is, you are like empathizing with the patient. Okay. So again, its management is important, but you need to explain what is Raynaud phenomena. Raynaud, it is the condition in which narrowing of the blood vessels due to an multiple reason. However, the exact cause is unknown. It could be due to stress, smoking, any reason. That's what compromising the supply to your hand, that's causing you the pain and trouble. Okay. What is the management? Management is do and not to do. What is do and not to do? It is like lifestyle modification. So you will be telling that keep your home warm. And trust me, in this scenario, if you forget about the lifestyle modification, it is gone. It is 100% gone. If in the Raynaud scenario, you are not talking about the lifestyle modification, you have taken the best history around the world, and this scenario is gone. Because this is what they want to listen, and you are not talking about that. You want to tell about the medicine and not about the lifestyle modification, because Raynaud phenomena, there is the medicine written, but you can say, no, you first go and do this. And in the next visit, if the symptoms are not going, then I will prescribe you the medication. Here, the lifestyle modification is the prime thing, like to follow. What are they? Keep your hand warm, wear warm clothes, especially like in the cold, exercise regularly, because you know it improves circulation. Tell them that exercise regularly improves the circulation. Try breathing exercise, help you relax, eat healthy, balanced diet, and don't do's are there, and don't do's are almost same. Don't drink, don't smoke, and drink less. Avoid caffeine and any trigger. Like these are the trigger that can. And tell about the medication. Okay, you can tell, you can prescribe the medication and you can send the patient home, but tell them, okay, and I'm going to like have a follow-up visit with you, and in the case you find any difficulty and it's not working, I can prescribe you the medication, which is nifedipine. The only calcium channel blocker here is nifedipine, not any other. It can improve the symptoms. Okay. Okay, you will, this is for you. You say, I am going to send for some specific and test. Why I'm sending these two tests, like ANA and RA factor? Why we need to send these two? Anybody? Yeah, exactly. To rule out that, because these both, look at them, RA factor and ANA, both are the non-specific test. And while the screening, what we do like the non-specific test. If this is your domain, if it's come positive, you will be sending that to. If it is a secondary Raynaud, that's not your domain. Your domain is primary Raynaud. If it comes positive, then you are going to send to the rheumatologist. Okay. Yeah. Okay. So this scenario is done, and you are going to do the safety netting. Safety netting should be there, like having the severe pain, like I mean the numbness, So safety netting should be there because it is important. And this scenario without safety, not telling the safety netting also will lose your marks. Safety netting is quite important over here. Okay, the next scenario is rheumatoid arthritis. It is not the difficult one. It is easy because the scenario we have talked about, these are the management type of scenarios, and some people find them difficult because history taking, we have developed approach, but for telling the management, we need to be specific for everything. Mic of somebody is open. Let me mute that mic. Okay. The next scenario is rheumatoid arthritis, FY2 in the surgery, female present with the pain in hand, take assessment, and she's a smoker. Other info, both hand started gradually 4 weeks ago, morning. And this is very much typical for because it is always bilateral. You know, it is always bilateral. Rheumatoid arthritis is always systematic, like it is bilateral. So this is a systemic disease. So after asking very few questions, we will know that is rheumatoid. Morning stiffness very much typical, and you will be asking about like how it is in the morning, and after getting the time, what is its effect, because it's quite important and it gets better with passage of the time. So that's why it is rheumatoid arthritis. And if it is getting worsening with the passage of time, it can be osteoarthritis, can be anything else. So for the rheumatoid arthritis, typically if it is getting better with the passage of time, it's rheumatoid arthritis, and it's always systemic. Okay, so you will be again asking because what she has taken, she will be telling you she has taken, that's only because you will not going to repeat that what she has already been taking. Yeah, then you will be asking about the numbness, you will be asking about the morning stiffness and skin change. Why? Because you will be in any of the rheumatological scenario, you need to bring 2 to 3 diseases in your mind. You need to bring them: trauma, gout, single joint involvement, and it is the redness. You will be asking about the joint redness because osteoarthritis can, septic arthritis can present with or the even the gout can present in that way. You need to ask all of these questions. Osteoarthritis, and you will be asking this typical question in this while you are doing the stupa KRS of pain. Tell me about your symptom, how they are in the morning and with the passage of the day, because normally we ask very general question, but in this we will be asking a very specific question. Tell me its relation with the day, with the passage of time. Is symptom getting worse or better? If saying worse, it's then think about osteoarthritis. That's getting better, or say it's staying the same. Patient can say it's staying the same, but then you will be like this very, now it is very non-specific. So you need to ask, rule out all of these. You need to ask about the fever, any medication, all of these questions. Starting with the trauma, gout question. You know what is the gout is very less likely because it's the systemic. The gout is never systemic. Then osteoarthritis question, I'm telling you, and fever and medication. Then ask, these are the questions we have already asked about, morning stiffness or all that. Then we will be doing the PMOLE, family dysautoly. In this type, in rheumatology, medicine is quite important. Which medication is taking? Why? Because there are certain medication which can cause, for example, if the patient is having gout and you are not asking about the questions regarding the which medication you are taking, and he's not telling you any medication, and the gout scenario will come. Here you will be asking about, is the first time? You will be asking, is the first time or it's the you have been having this multiple time? Why? Because if it is having the recurrent, the treatment will differ, especially in the gout. So before knowing about which scenario it is, you don't know what it is. So you should have your plan of action, asking the question. So you will be asking about, is the first time? Are you having that before even? Are you suffering from any long-term medical condition? She will say, yes, I'm suffering from hypertension, for example. Then you ask what you're taking for that, since how long you're suffering from that. Then you will ask about any allergy, hospital stay. Why? This is again very much important. Maybe some surgery has already been done and you're not asking. Then desatoli, again very much important, because smoking and alcohol is quite important, exercise is important, and impact on life. Always in the chronic diseases, ask about the impact of life. Any like shortness of breath, if it's the chronic, ask about the impact of life and occupation. I'm repeating this just for you to remember that. For example, just having some like audionic memory again and again. Then ask about, then do AIC, PMA, Holy Family. Okay, after AIC, then do the observation, examination, neurological examination, and check for reflexes. And then now the management explained that what you have told me, it look like you have some inflammation of your joints. This look like disease called rheumatoid arthritis. When it is the rheumatoid arthritis, it's not your domain. Game now has become easy for us, because now it is rheumatoid arthritis. It is not of my domain. Okay, but you will not be saying that it's not none of my domain. So you will be managing, but the management of not your domain is different. So the first thing is referral. The first thing should come in your mind is the referral. Okay. So you will say that I'm going to give you paracetamol and ibuprofen. With ibuprofen, if she's saying that I'm taking one of them, you will say, okay, you are going to take both of them. Along with them, I'm going to give you the PPI for the stomach. I'm going to give you the PPI cover. I would like to run some special tests. This is the rheumatoid factor and CCP. These both tests should come out of your like voice when you are talking. These two tests, CCP and rheumatoid factor. RA factor. RA factor is a better word. RA is easy to remember. RA factor and anti-CCP. These two tests, you will say why. You will be doing this and you will be sending to, you will not be checking it, but you will saving his time. Okay. The specific management, you will be referring to the rheumatologist, and they will be like doing x-ray and all that. You can do x-ray by yourself as well. You should actually do x-ray as well. And x-ray as well. And after that, you need to tell, this is the specific management is with the rheumatologist. I'm going to refer you with the rheumatologist. And after that, long term, you need to tell that this is a lifelong condition. This is the counseling. No, it is your turn again. You are counseling the patient. Unfortunately, it's a long term medical, it's a long lasting medical condition. You need to learn how to live with it. However, with the medication, and we can get control of your symptoms. And you need, because you have already asked about what work do you do. She say, I'm a typist, I'm doing this. You are going to refer to the physiotherapist and occupational therapist. Never forget these are your domains, because you need to tell that. Okay. And counseling about the stop smoking. Again, safety netting is septic arthritis. What is the safety netting for this? Safety netting for gout and rheumatoid arthritis is septic arthritis. Fever, worsening of joint pain, you need to come back. Okay. This is all about this scenario. So it is like urgent referral. You are going to refer within 3 working days. The other scenario is the gout scenario. FY2 in the surgery presented. Actually, I have discussed this scenario with you as well, because I was like making your approach towards. We have discussed this scenario. You will see that we have diagnosed with hypertension, taking like benflumethiazide, and the patient discuss the management. Assess the patient, discuss the management. I have pain in my right big toe. Right big toe is very much specific to this, but you will not assume. You will rule out everything. It started 1 week ago. My big is swollen and it's red. I'm not able to walk properly, because you cannot assume that septic arthritis can present in this way as well. Why? How we can assume? We cannot assume. So we need to rule the septic arthritis back, because that is the red flag over here. So we need to rule that out. History of fever, smoke, and drink 4 cans of beer like this. 2 risk factors are here for. Which are they? 2 risk factors are here. Any of you, 2 risk factors here are for gout in this scenario. Which are they? Anybody? because you need to ask these two risk factors. And while telling the diagnosis, you will be telling these two risk factors to the patient because you are having this and that. No, it's not NSAID. Here, NSAID is not a risk factor for gout. I don't know it is, but yeah, high protein diet is. But here in this scenario, which are two risk factors? The scenario is in front of you. I have like put in front of you, which are, one is alcohol, and which one is the second one? Diuretic. Yeah, it is diuretics. It is, this is very much typical. Actually, you cannot forget to ask this because this is actually very typical to gout. And in the management part, you are going to tell that this is because of you're taking this, and we need to shift that to another medication that we are going to discuss later. So you can start with paraphrasing or what brought you here, whatever. Then you will be doing from the stupa KRS of the pain. Then anything tried, she taken paracetamol, and like you will be asking all of these questions. And regarding the DD, you will be doing the trauma, gout, septic arthritis. These are the very typical questions. You'll be asking about the reactive arthritis. You know what is reactive arthritis? Patient can't see, can't pee. So you can ask a question about his urination problem, okay? So reactive arthritis can present in similar way. Any history of infection, you can ask, because it's actually no need to ask because it has already been asked in the septic arthritis. Any history of infection is over here. Yeah, you're right. In the reactive arthritis, any history of infection can has reactive arthritis. Then osteoarthritis. These are all DDs. You need to you can forget and one of them, or but never forget about the septic arthritis. Septic arthritis is actually red flag. I should put it here is as a red flag. And in here, past medical history is quite important. We have already talked about how this is the first time or it's a recurrent case. Because if it is a recurrent one, you need to refer it to the rheumatologist. But it is the first time, you can manage by yourself. That's why it will affect your management. If you are asking, not asking about, is that the first time? Because in general, we ask this kind of question. Is the first question in PMMA, Holy Family Dysautonomia? So you will ask this question. Then you will be asking about he will say, I'm having hypertension. You will ask him what you're taking. Then he will be saying that I'm having this medication, diuretics. You will be asking how much, since how long, all of these questions. Then you will be asking about the smoking and all that history. Then you will be asking about the occupational history, because why we have talked about this is quite important. In OET exam, we will be doing neurological examination of toe and foot, and they will be giving you the pick of the big toe. That's it. Explain the management. You have told me that from my examination, it's like you are having inflammation of your toe, raised, it could be raised of uric acid. Your high risk factors are taking the medication, and you are having more than the recommended alcohol. These two are the risk factor. Okay. So what will be your decision? I'm sending some routine labs, blood test, and I'm going to give you the painkiller. If this doesn't work, you can come back. I can shift you another medication, that's colchicine. No need to go for this. You can just it is for you to remember. If you are telling the 2-story treatment, not need to tell the 3-level treatment. You need to change your medication for high blood pressure, and I'm sending the uric acid levels. Okay. So again, you are going to talk about some do's and not to do's. Quite important here. What are they? Like, you need to take the medication. Take any medication you have been prescribed as soon as possible. It should start work within 2 days. Okay. The medication, which medication? Painkiller. Here we are talking about the painkiller. Then rest and raise your limb, because it also lower the edema. Then keep the joint cool. It is to lower the inflammation. Drink a lot of water. Try to keep bedclothes off and at the night. Try to keep bedclothes off the affected joint at the night. Okay. Do not do pressure on that. Do not put pressure on the joint. That's it. Important is when the referral is required. You should know when the referral is required. The referral is required when it is the recurrent case. Then why? Because then you need to explore, is there any ongoing cause? And you need to tell to the patient, you need to counter the patient. If it is the recurrent one, then I'm going to refer you to the specialist rheumatologist, call some rheumatologist, and they may like run a couple of more tests. Like they may need to take the sampling from your joint. And in that case, they can give you some urate lowering agent, allopurinol, you know what are they, but you're not going to talk about. If the and tell the patient, if it is not improving within the 2 days your pain, you can come back and I will have your follow-up test of uric acid after 4 to 6 weeks. That's it. This is whole scenario. And do the safety netting for septic arthritis, which we have already talked about. The rheumatology scenarios are done. Any question regarding first 5 scenarios? We have done till now first 5 scenario, and trust me, these are quite important, very much important. These scenarios are very much important, and all of them are the management based scenario. Most of them are the management based scenario because their management is very specific. You can be deceived in that way because you are thinking something else. Because this is management, you need to refer from like rheumatoid arthritis referral. You should know that this is the referral patient. And if it is the gout patient, it is the first time, you need to manage. Then these are the a bit easy scenario like urinary tract infection. Most of these scenarios we have already done. There are 3 urinary tract scenario, and we are going to start with that. URFY2 in GP. A 25-year-old presented with lower abdominal discomfort. Take focus history, make diagnosis. I'm not going to like read this because this is very much commonly asked questions, and I think you already know about them. So what I'm going to do is I'm going to go grapes after tell me more about that. Like it's abdominal pain. You are asking about like Stupa KRS of the pain. Then what are the DD? You know, it is whenever this kind of symptom, UTI is the first. Whenever, and just in this kind of scenarios, you should be in your mind either is the male or female. Because why? Because the topic is very much common DD of this, and the male and female in UTI scenarios are quite important. You need to know it's male or female. You need to have very keen because your questions set of questions can vary. Okay, first of all, ask about the UTI. All of these are the UTI questions. A lot of UTI questions because it's the rule-in questions. Because if the patient is having a particular symptom, you need to, and you have done the Stupa KRS, first you need to rule that in. What is rule that in? It is the UTI. Ask all of these questions. Pain or burning sensation, any fever, need to go to the P more than often, need to get up for the P more than often. Any urgency, any blood in your pee. Now you need to ask any tummy pain or pain in your back, because the UTI can sometimes present with the pain in the back. Why? Because if it is the pyelonephritis, it can present with, because the UTI is a very broader term. It can be cystitis, it can be pyelonephritis. So if it is the pyelonephritis, it can present with the flank pain, back pain. So you need to ask this question, okay? And then you never forget, this is the UTI. These questions are the UTI question. And these questions should be on your tips, because these are easy questions and most of them you already know, and just make a drill of them. Then STI discharge. This kind of question, usually you forget. I know everybody of you will be asking these questions, but not all of you will be asking these 3 questions. One is STI. STI, any discharge. You need to ask this because you will forget. Because in the UTI question, you ask a lot of questions regarding the UTI and you forget to ask any question, other question. But it's not like that. It can be anything else. because it can be having STI converted into UTI, because it can be anything like that. So you need to ask a typical question regarding the STI question. Okay, any discharge from your private parts, then the renal uh, pain radiating, renal stone, any blood in your urine, blood or any irritation, any stone in your urine, or have you been told you are having the renal stones? So these are kind of questions you can ask. And ectopic, obviously, regarding if you want to ask about the ectopic, it should be the female. You're not asking in the obviously in the male. And in the female, what you're going to ask, when was your last menstrual period? This was the first question you're going to ask to rule out that topic, and he'll be saying like it is like 1 week before, and that no need to ask any other question. Then these are the red flag. Why it is these are the red flag? Any shivering, back pain. Why? Because it is the pyelonephritis question. The confusion it is for the sepsis, and then of course regarding the cancer question, any blood in. We have already asked most of these questions, but you should know if you forget to ask over there, you should forget. You should have in your mind, I need to ask these 3 red flag questions. PMA, Holy Family Disorder, you will be completing all of them. And menstrual history, I have talked about. Menstrual history and sexual history is important over here. Why? Because you need to ask about do you practice safe sex? You need, why? Because it can be STI. Then ICE OET examination, and in examination, never forget in the UTI question, never forget to ask about the urine dipstick. This is the most important thing you should ask. I know you know all of them, you know about this, but people, while taking the history, generally forget very easy things, because these things are not in our drill. We know about that, we have the knowledge about them, but we forget to ask. But such kind of blunder, 2 tests in UTI, 2 tests in UTI. One is urine dipstick and other is pregnancy test. If it is the female, it can save you. These 2 tests will tell that your approach is perfect. If it is the female, you need to ask about the pregnancy test, and if it is like the male, only one, then urine dipstick, and in the female, both of them. Okay, then what is the management for the UTI? You know about that very well, because it's your domain. You are going to give the antibiotic. It's not you are going to wait for anything, because you have asked about the allergies. And in such kind of, in any infection scenario, you have not asked about any allergy. This is the blunder. So you have asked about any allergy. If she says, yes, I'm having the allergy to this, you're not going to prescribe that medication, some other drug, some other class. So here, this is in your, this scenario is in your prescription as well. This scenario is in your prescription scenarios as well. Giving the antibiotic natrofurantoin, for normally the antibiotics are given for 5 days, but it is here for 3 days only. Okay. And this is just for you to know about if she is the pregnant. Natrofurantoin is contraindicated in 3rd trimester, and if the 3rd trimester, then cephalexin 500 mg for 7 days. Okay, can't give trimethoprim in all trimester. If she's pregnant, can't give trimethoprim because of the neural tube defects predisposition. Okay, then this is what you have told the medication. From what you told me, you are having waterwork infection. This is called in common language waterwork infections. And what is your decision? I'm going to give you painkiller. I'm going to give you antipyretics. Like she's having, if she's having like any fever, you are going to give like antipyretics, and some you are sent for the urine culture and going to give the device wipe from front to back, not back to front. I hope you understand that, because that poses the risk of UTI. This is the counseling. This is actually the counseling to prevent it from in the future. Then again, the safety netting is for high temperature. Pyelonephritis is safety netting over here. Pyelonephritis or cancer. Pyelonephritis and cancer both are safety netting here. These are the red flag. These are the same. Most of the time, safety netting. This is very and red flags are like same. Like here, you need, this is the red flag, pyelonephritis and cancer. It is the safety netting again. The, quite similar scenario. I'm not going to discuss it. This is the similar, exactly similar scenario. Nothing is changed. Everything is staying the same. Okay, we can read about it. It's going to start on nitrofurantoin. It will also take second option from the senior. As you are on methotrexate, you have low immunity, we need to send you to the hospital for antibiotic through your vein, because this patient, if the patient is having sepsis, if the patient is having sepsis, or the patient is very old age, or the patient is having like is on the methotrexate, this patient is on methotrexate, you should send, because now it is on the curb 65 score, it is high UTI, like sepsis in the, we do curb 65, that's why it's high, so you need to send to the hospital, because it is again presenting in the GP surgery. The other scenario was in the GP. However, in this, the patient is on methotrexate, you will involve the senior, and you will take the second opinion from the senior, and you will be sending that to the hospital. Why? Because the patient is immunocompromised. What can happen if it is immunocompromised? Anybody of you? Why we are sending immunocompromised patient to the hospital? Look, both scenarios are quite similar. The only thing is he or she is on methotrexate. Nothing changed. Everything is same. That's why I'm not repeating the scenario. Nothing is changed. Only the person is on methotrexate. Why we are sending? Okay, the thing is that immunity is low, but why we are not treating? Anybody? It can go to sepsis. It can develop sepsis. Of course, it has a very high risk to develop sepsis. That's why we are sending like to the hospital, so that it can get medication through veins, because in the GP you cannot give the medication through veins. That's it. Other thing is normal. So in both of these scenarios, the difference is only methotrexate. That's why the other patient we were sending home with the medication with safety netting. This patient we are sending directly to the hospital because he's immunocompromised. Okay. The other scenario is UTI with BPH. UTI, so two approaches are required. BPH requires one approach, UTI requires second approach. These two approaches are, UTI approach we have already discussed, and I'm going to discuss with the, what are the scenario ever two in the urology. No, you are in the urology, not in GP. 75-year-old gentleman presented with dysuria. Gentleman, uh, take a focus history, perform relevant examination, discuss initial management with the patient. One thing I want to tell you, I want to share it with you, because when I was taking some, uh, I taken a mock test. In that scenario, what happened? Actually, there was a very weird name. I didn't know it's male or female, because in the mock test, they are not following uh, uh, the exact protocol, because in the real exam, if the female patient is there, then in front of you will be the female with the same age. Nothing will be changed. But in the mock test, they just bring some actors, and the males are the female. Sometimes females are doing the acting of the female. And one female was sitting there. I just failed me, because I asked, because the name was weird, and I asked, "Are you male or female?" And they gave me zero in like in the IPS, because I don't know, because it's the male or female. But it's true. You cannot ask about because it's male or female, because it will be there in front of you. It will be male or it will be female. Okay, uh, just to tell you that you cannot ask this question. Okay, it's, you need not to ask. And the patient information is, this is regarding the urination, and the other is, you will be asking about the question, and he will be giving you the clue that from the past you had this passing in urine and felt hot. This is all about problem with uh, his UTI. Okay. Now he's telling you another information. When you ask about what work do you do, his office clerk, because your frequency you have, because of your urine frequency, you need to sit near the door, go to the toilet easily. That means he's having some constant problem. Okay, you cannot concentrate at the work easily. This is impact on life. He's telling about the impact of life. Your wife complains that there is much smell in your urine. So these are the all questions you can give your own read. Again, doing the grapes after examiner prompt is when you ask this question, they tell you abdominal examination. When you say I'm going to do the abdominal examination and I'm going to do the PR examination, that is prostate exam, enlarged prostate will be there. Okay, so first of all, you ask about the stupa KRS of the burning. These are all of the UTI questions. Then ask about the prostate questions, and these are the typical kind of prostate question we are going to repeat in the other scenario as well, because the other scenario is the incontinence, and the prostate has the kind of similar approach. Why? Because in the prostate you have some kind of incontinence actually, because there are type of incontinence. One is urge incontinence, one is overflow continence. Actually, the prostate continence is overflow continence, in which because of the obstruction, always urine is there, you cannot evacuate the urine. And the one is stress incontinence, one is urge continence, one is overflow incontinence. So it can be present in a mixed way. So these are the prostate questions, are actually the incontinence questions. You need to ask these questions in any scenario with incontinence. Okay, urine incontinence. Do you need to rush to the toilet in general? We say yes. Do you need to wait a long time to start peeing? Do you need to stain a lot? These are the prostate questions, and you will be asking these questions in any of the urine incontinent questions. How is your stream? You will be asking about the stream. Have you ever seen blood after passing urine? Do you feel dribbling? Wetting of pant, dribbling is very much important question. Or leakage, incomplete evacuation. Sense of incomplete evacuation is again very much important question in here. Do you go more frequent than usual? Do you wake up at night for the toilet? These are we have already asked about. The red flag, if you are not asked about, then you will be asking about the blood in urine and back pain. Blood in urine and back pain. Because this can be prostatic cancer. So asking about the family history, dosatoli and family history. In family history, you will be asking about, it will be wonderful. I should give you a clue. If the person is you are having suspicion of GI cancer, you are having the suspicion of like uterine cancer, you are having the suspicion of prostate cancer, you can ask one very important question. This is like, is there any history of cancer in your family? Say no. And you name the cancers. Any prostate cancer, any colon cancer, okay? Any reproductive system cancer. That's it. And then you will be doing observation, abdominal, and passage examination. Abdominal, and these are the important points here you cannot forget. And urine dipstick again here. You will be asked. This is again very much important, as we have all talked about, and you will be sending for the CBC. OET for observation, examination, and I'm writing them like in a single go because we don't have a lot of time like to deal them separately. Then it comes towards the management. Explain that your back passage, and it tells that you are having the prostate enlarged prostate, that is called the BPH, benign prostate hypertrophy. That's why you are having recurrent you are having this infection, because this pose you risk, because the urine is not evacuated completely. That's pose you the risk of this infection. You need to tell this, because this patient is having BPH along with UTI. So you need to explain the BPH first, then tell that this is causing UTI. Okay, you can come either way, no problem. This is not a big deal. If you have prostate enlarged, That's obstructing your outflow. That's causing the bacterial growth over there. What is your decision? Because the older person, you need to admit the patient. Similarly, because again, similarly, the methotrexate patient, this is the older patient, you need to admit the patient, run a couple of tests, start with IV antibiotics. You need to do the PSA. Here the management are two. Here the diagnosis are two, not one. The second management, for the management of the second thing, you need to involve the seniors. For the management of the second thing, you need to involve the seniors, because that's a long run month, and you are going to investigate for that. Okay, we are going to investigate for that medical, and its management can be depending upon your situation. Its surgical, it management can be surgical, or it can be medical. It can be medical and surgical. And then you obviously you will in the hospital, you can do a safety netting while keeping inside the hospital. You can like say this to the patient: if you are like admitted, if you feel any sign of high grade fever or anything, you just call to the nurse on duty. You can do safety netting in this way. Now comes another approach. We have already talked a little bit about, but here we are going to talk again. Incontinence. There are three types of incontinence. You need to rule that out. You just your in this history is quite important. This is a history taking scenario. This is not a management scenario. This management they know is easy. This is history taking. Sorry, history taking and management both. The UTI is more history taking, and this is again more history taking, because you need to rule the three causes out, not only one cause. What are three causes? It can be stress incontinence, and you need to take a proper history in this. You cannot forget even the PMA Desotoli to asking, because he can have a surgery, and the surgery was the hysterectomy, and that's why that's posing the risk, or anything that can bring his any long-term medical condition. He's coughing a lot, anything like that. So you need to ask all of these questions. So first thing, incontinence approach, do you need to the rush to the toilet? Hesitancy. The second thing is hesitancy. You need to wait very long time starting the pee. You need to strain a lot. We have already talked this about how is your stream, any blood, any dribbling after. And these are the kind of questions. For example, how we can differentiate based on this kind of question, because here we are asking stress incontinence question. Any problem while coughing or laughing? This is stress incontinence, simple. And the person is having hesitancy, need to the more to the toilet, and dribbling and all that. This can be stress. This can be, it's not stress. It is what this is called. Urgent continence. Urgent continence. Overactive bladder. Overactive bladder is urgent continence. All these scenarios, hesitancy, the straining is because of the obstructive incontinence or overflow incontinence. So we need to rule three causes out. For example, stream is weak, need to strain a lot. This is not urgent continence. Dribbling pants, this is urgent continence. Dribbling of pant is urgent continence. Do you rush to the toilet more? This is urgent incontinence. Okay. So we need to ask all of these questions. You can arrange by yourself. I should have arranged in that way. But these are the three kind of questions you need to, what should be in your mind: stress incontinence, urgent incontinence, and overflow or obstructive incontinence. Like there's obstruction going on over there. So you need to ask question regarding three incontinence. Then they will be telling you, and you will be asking about PMA, Holly family, Desotoli. You will be asking all of these questions. Why? Because Desotoli is Desa is important in urgent incontinence. Coffee, alcohol, all are the risk factor. Any coffee, any drinks, any coldness. The patient is working in the cold. That is in urgent incontinence. Okay. Similarly, HO, Holly family is important. HO is operation, and hospital stay is important because operation pose risk towards stress incontinence. What is stress incontinence? On coughing. Similarly, any long-term medical patient is having long-term coughing. Patient is having like menopause, and that again poses to the stress incontinence, risk of stress incontinence. Okay, so you need to ask. This is important question. Trust me, this scenario is important. There are more scenarios for this, but if you, this is easy. If you know about the approach, this is confirmed past station. If you know about the approach, because this is easy. You if these three things are in your mind, you will be asked a bundle of questions. Then you will be asking about the UTI symptom. You will be ruling out your DDs as well. You will be asking what are the DD of this. This are the prostate cancer, BPH. You will, a lot of DDs have already been done over here. So you need to ask about any fever, any recent fever, UTI. Ask about UTI. So it is DD. The red flag is here again cancer, BPH. PMA Holy Family Desartoli is important here. I'm repeating in this scenario, PMA Holy Family Desartoli is important because here impact on life, because he will be very much embarrassed. Why I is important here? The patient will say, I'm really embarrassed. It is embarrassing situation for me. So you will like at that time you will talk to the patient. I can understand that this becomes sometimes very difficult to handle with the situation. So you need to empathize. If you you are not doing the bowling, then you're not doing the batting. So the clue is here. Whenever you are asking these questions, then you will be telling, you will opening the patient with you, and your IPS will be good. So you need to ask PMA. In most of your scenarios, PMA Holy Family is your for your IPS. In their IPS is hidden. Okay. Observation, because for example, most of the time you think that this is PMA Holy Family, this at all is not that important. This is half of your history taking. This is half of your history taking. So consider that important as the other part of the data gathering, which is HOPI. Two part of data gathering, HOPI, and other one is history taking. Its history. PMA Holy Family Desartoli is his history. So both are important. Again, is overactive bladder, contraction of the muscle of the bladder, which gives you the urge to pass the urine, because it's the urge incontinence. It says that after evacuation, I feel that I have not evacuated. Exact cause is not known. Decision, because it is not giving any risk factor. So you will, if the giving any risk factor, for example, any code, anything like, you can tell. If not, you can say it's not identified risk factor. So lifestyle modification are quite important here. Lifestyle changes are losing weight, cutting down the caffeine and alcohol, pelvic floor exercises. Pelvic floor exercises is actually typical. Actually, there are types of pelvic floor exercise, but you will be say pelvic floor exercise. It's enough for you. Pelvic floor exercise, you strengthen your pelvic floor muscle by squeezing them, and bladder training. Never forget these two words, bladder training and pelvic floor exercise. Actually, in this scenario, in this particular scenario, bladder training is a way more important than pelvic floor exercise, because the pelvic floor exercise is more with the stress incontinence. That is urge incontinence. What is bladder training? Bladder training is you actually tell the patient, because whenever the patient is having like urge to urinate, you say you need to stop that consciously. That's why it's overactive bladder by and by can learn how not to react, because this is kind of functional disorder. Okay. So bladder training in this scenario is important, but however, you will telling about the pelvic floor exercise. But if it is the stress incontinence, coughing and sneezing, then the main thing is the pelvic floor exercises. So you need to tell both of them in the both of those scenarios. Okay. You also may benefit from the incontinence product, absorbent pad, and that this is all you are telling about the lifestyle modification. Medication may be recommended. This time you will not recommend any medication, because but you need to tell to the patient what are the medication which are recommended. Anybody? Just to know about the knowledge. Otherwise, you're not going to tell. You just need to tell that medication are recommended. Actually, this is alpha blocker. Alpha blocker, or I think oxybutynin, or some kind of, I don't know, but it is alpha blocker. Alpha blocker medications are working over here. For reading only, you need to tell that the surgical option, surgical options are not for overactive bladder. I'm just why I have put that for reading only, because if you go to the NHS side, they are taking incontinence as a general entity. But you should know that in overactive bladder, what uh, there is no like a role of surgery, but in um, urge in the other one, that is the stress incontinence, of course the pelvic floor strengthening is important, and in that surgical options are available. You just read that. In the case the patient can ask you, you can tell. Otherwise you need not to tell the surgical option over here. Are you going to give me some medication? No, I'm not going to give you some medication. However, you go and I'm going to prescribe you lifestyle changes. I'm going to give you the pelvic floor exercise. I'm going to tell you about the bladder training. If it's not working, then come back. We can think about giving you medication. Okay, not like that. Not right now. Safety netting is for UTI and cauda because the cauda any numbness, any around, because it's not like it can lead to cauda but if patient can have cauda due to any other reason, he's thinking I'm having the incontinence. So that's why you need to like do safety netting for cauda and UTI. Okay, this type of scenario is almost this is again done, and the next type of scenario is LFT scenario, a deranged LFT. This is again easy scenario, like UTI scenario was easy scenario, and incontinence was a bit difficult because this is for most of us it is new approach. LFT scenario is quite easy. It will be easy for you because you have already done these type of scenarios. Alcohol misuse, abnormal LFT scenario. Okay, we have done the alcohol already, so I'm not going to teach you how we deal the alcohol because cage approach, cage TW approach we have done. FY2 46-year female come for the follow-up. It is the follow-up on the GP. She came to Well Woman Clinic and had blood test done. Blood test showed HB normal, MCV high, ALT high. Talk to the. We have discussed that such kind of scenario we have a similar approach. When we have the result with us, we have the similar. First we will explore, then we will be telling about the normal results. What are the normal results here? HB is normal. Luckily, blood test shows that fortunately your HB is normal. However, it shows MCV is high and ALT is high. And they will be giving you, they can give you the readings, not in this way. It is written over here. They will be giving you the readings. You will pick by yourself. Okay. Live with her husband, a lot of argument with her husband because of the drinking habit, worried about the relationship, drinking half of the bottle is the drinking scenario, and the why it is in the medicine because of the deranged LFTs. Otherwise, it is we have already done the drinking scenario. But I'm going to talk about the medical aspect. Not there is another scenario. FY 265 will come for the follow-up. His AST-ALT ratio is that. Similarly, after taking the history, you will be telling, fortunately, your FBC is normal. MCV, however, your MCV and AST or ALT ratio are high. As AST is this and ALT is this, you will be telling in this way. Which signifies, you will be telling which signifies that it signifies that there is ongoing some liver injury. There is ongoing some liver injury. You will be telling that. Okay, let's start the scenario. Okay, in this kind of scenario, when the AST LFT is deranged, you will be direct asking after doing the grapes. It's the follow-up scenario. Both are the follow-up scenario. How you will be start about grapes 4Q, grapes 4Q, grapes 4Q. What are the 4Q last time? Why did last time these tests? You will asking 4Q, asking the 4Qs. Then ask about the jaundice. Question about jaundice. Why ALTS is raised? You need to ask the jaundice question. Yellow eyes, yellow discoloration of the body, stool color, pee color, and itching. These 5 questions ask about in any of the this scenario. Asking, then ruling out the DD. Hepatitis is the first, should be the first, because you don't know about is the person, because if it is like given over here, and you will be asking about the hepatitis, how we can rule the hepatitis. This is very much important. First, ask about the hepatitis A question: nausea, fever, diarrhea. Nausea, fever, diarrhea. Any recent eating at some restaurant? Any recent outside eating? These are the hepatitis A question. And hepatitis A question are they, and hepatitis B and C is the tattooing. And unprotected sex. These are the questions for the hepatitis B, C. Food is for the A. Sexual history is for the BC. Then you can ask about hemolysis should be in your mind, but there is no any bruising, any like that. You can ask put one question, but it's not that important. Then you will be asking about PMA Holy Family Desatoli. In that, she will be telling you she drinks a lot, and then you will be doing the cage, TW, alcohol dependency questions, and then effect on the effect on life, and ask all of these questions, and ask about, you cannot forget to ask about any long-term medical condition, any medication, because sometimes medication can cause hepatitis. You cannot assume by yourself because she's drinking, she can have only hepatitis because of she's drinking. No, she can have hepatitis because of anything. So you need to ask all of these questions. Any long-term medical condition, taking any medication, any allergy, any hospital admission, any recent blood transfusion, anything like that. Then PMA Holy Family Desatoli, in the Desatoli, going to she drinks a lot. And then you will be doing the cage TW. This is important. Never forget doing this, because we have talked about that. What is cage TW? This is about the dependency 6 questions. Effect of symptoms you ask. Then what is the management? The result MCV is high. The certain chemical ALT is high. Right now, we are not sure, but it could be because of the drinking alcohol. Don't say alcoholic liver disease. Don't say that. Because of the drinking alcohol. Because for diagnose at the alcoholic liver disease, you need to do the ultrasound, and that's the fatty liver over there. Without that, we cannot say that this is the alcoholic liver disease. Better to say because it's are high because of a lot of alcohol drinking. From what you have, it look like you have some problem with your liver. This is because of binge drinking a lot of alcohol. Okay. And we need to take a lot other tests: AST, GTT, AST, and ALP. We need to do these tests, and in long term offer sport. And this is actually this scenario we have already done, and this is kind of that scenario, because in this, for example, if it due to the alcohol, we have diagnosed, we cannot give any medication. What we can do, we can do the same which what we're doing in the cage scenario. I taught you approach of the cage, and in this we are going to provide the sport, avoid the CBT, counseling, anonymous A group. I've not written all of them because we have discussed that in a very, very brilliant way. So you will be offering all that, and low safety netting in low mood, any tummy pain, any change of the discoloration, because these are the acute fulminant hepatic failure. This is any problem with tummy pain, any vision problem, any change in color. This is the fulminant hepatic failure. Okay. So you need to do the safety netting. Follow up with the blood test results. You are doing. We have discussed both scenarios here together, but be specific regarding any scenario. For example, in one scenario, AST and ALT are high, more than 2. This is typical of alcoholic. And other one is only ALT is high. So you need to, because the only ALT is high, it can be due to any reason. AST, ALT high, it is typically due to alcohol related disease. Okay. So you need to ask be specific in this. For example, if it is the AST, ALT high, your suspicion of alcohol is high. But if it is ALT is high, only ALT is high, so you cannot be sure that it is due to alcohol. So you need to say that because this is your approach. Other one is hepatitis A. This scenario again is similar scenario, but in here ALT is this and ALP is with the normal ALT is high, very high. AST is not that high. So it should be in your mind when the ALT is high, it is something, it could be hepatitis, like hepatitis A for your to understand. If the AST is more high, yeah, AST ALT ratio is more than 2, then it is alcoholic. Okay, so but never assume you will be taking all of the history again, and while taking the history you will be asking all of these questions again and doing this and asking the PMA Holy Family Desartoli, and in that you will be asking what kind of food you eat. Have you recently eaten anywhere outside? And there she will be saying, yes, I have eaten. And what about the other family members? Ask about the other family member because it is the communicable disease. For example, if you all of you people have eaten on the same restaurant, why it is not only you, can be other family member as well. These two kind of scenarios are similar. One is with diarrhea. The patient come with the I don't know, it was diarrhea or vomiting. It is food poisoning actually. And this one is the second with hepatitis A. Both of these are the restaurant Kamal. Like both of them, like you need to ask about the restaurant history. Okay. And like here, you will be asking about what kind of diet you eat. Is you eat normally, and ask about how often you eat outside and have you eaten recently. Ask about the restaurant. And in the management, regarding its management, you need to tell that this is normal, this is abnormal, this is could be due to hepatitis A. And again, the management is two management. One thing management is like sporty management. You need to tell the sporty management to the patient. And second management is second management is this where it has gone. The second management is to the notifiable disease. That is the social management. One management is sportive management. You are going to manage this disease sportively. You need to tell that it carries its incubation period is 2 weeks, and after that it will go on its own. But meanwhile, you need to take like a lot of plenty of water. You need to take paracetamol to avoid any fever. This is the management you are dying. And the other management you need to tell is it's a notifiable disease. I need to tell to the authorities, and he might be saying that no, it's my friend. You cannot tell this to authorities because they are going to see. Then this, you have already done this scenario in the counseling station that you are going to talk to that. It's not always they seal the restaurant. Sometimes they give the warning. Sometimes they then even if they say, if we insist, don't tell, you need to tell that because it's a communicable disease. The other person are at the risk. It's under my duty. It comes under my duty. I need to notify. So here in this, there are two management. One is the manage to the patient. The other one is manage the others, which are not there. Okay, it is communicable disease. That's it. Analgesic nephropathy. That is, I think that's the second last scenario. Analgesic nephropathy. FY in the GP patient, 50-year-old has come, but follow-up has come to the well-man clinic last week. Blood test was done. HB is low. This is very important scenario because it is deceptive scenario. Most of the time, the people get deceived due to low HB. I'm telling you, because this is a deceptive scenario and you should know what scenario it is. Memorize this. GFR is low. Actually, they are not given the HB like this. In the real scenario, they are given a lot of tests over there. And in these tests, GFR is low and HB is low. Everything is normal. Here it is quite easy for you to pick this up. But when in the real scenario, whenever the values are given, you forget to pick up this GFR low because it is low. So you think that it is actually this is low HB scenario, and you start with asking the question with the low HB and you go with like dietary modification and you go over there. So just keep in mind, this is analgesic scenario. Everything is normal. The patient is having osteoarthritis, he take codemamol. This is the clue. And how it, if you do not ask, he's not going to tell. If you do not ask what medication you have, what long-term medication, what long-term disease you have is going to say, yes, I'm having osteoarthritis. What you take for that? I take for Demamol. It is the clue. Otherwise, there is no clue for you to tell why this is happening. So again, in this scenario, PMA dysarthroly, Holy Family dysarthroly is important. However, like this, because after reading this, you need to ask 4 questions. Then you need to ask about anemia question, any shortness of breath, any palpitation, UTI question, renal stone, and DM and hypertension. You can ask in PMA Holy Family dysarthroly, any long-term medical condition, any such as diabetes mellitus happen, any hypertension, because diabetes mellitus and hypertension both are the risk factor for this deranged urea and GFR deranged, because renal function tests are deranged in both of them. So you need to ask both of these questions. However, it will give you no clue. The clue will be when you will be asking about osteoarthritis, and you will be asking about the medication. Okay. Observation, GP, and abdominal examination you will be doing like you have already done. Then the result, you will be telling about the normal result, then before normal, then after abnormal, then you will be telling this is due to what. This is very easy scenario, but just it is some kind of deceptive. If you do not get deceived due to this clue, then everything is okay. This is otherwise is easy scenario. Then you will be telling your kidney is not functioning properly. Actually, you are taking this medication in this, you are taking for a very long time. This contains NSAID. It is actually NSAID-induced nephropathy. You will be telling because of that drug. What is your decision? You need to stop taking that painkiller. If the pain, you cannot bear the pain, fine, we can prescribe you some only codeine, because it is taking the combination. So the codeine can be taken in the, like you can prescribe, if you can bear the pain. If you cannot, I can prescribe you the only codeine. Okay. And long term, you are going to refer to the nephrologist, because the insult is there. You need to send to the nephrologist, because already insult of renal is there. So your task is to stop that insult to grow more, but it is the nephrologist domain to assess the patient. Okay. Then they will be doing these or these tests. You tell or not, this is not that important. However, you can tell they are going to run some specific tests, which are the ultrasound, and ultrasound is, I think, enough, not go beyond that. Or you can say the CT scan. Also counsel regarding the osteoarthritis, I'm going to refer you to the rheumatologist. Never forget even this, because this rheumatologist has prescribed the medication. And I have put on the many places, whenever he says, ask who prescribed this medication. If it is the GP, you can change. If it is some specialist, then refer to that specialist. This is the like rule of thumb. You say it's a rheumatologist, you say I'm going to refer you to the rheumatologist so that he can change some other medication, some good medication for you. Okay, some safe medication for you. Counsel regarding the smoking cessation, because any person coming with a smoking, you need to counsel regarding the smoking cessation. Safety netting. Blood in urine, swelling in leg, like face. This is like this is all about like he's having renal failure. It is not the last one. I'm having the 2 more. Okay, the other scenario is erectile dysfunction. Erectile dysfunction are more scenarios, but we are doing the only one, and the approach is same. It could be due to any cause. It could be sometimes it could be due to unknown cause. However, you need to have some approach in your mind that how to deal with the erectile dysfunction scenario. Okay. Scenario 1 is no cause patient. I have a personal problem. The first thing in erectile dysfunction, you can like have very big blunder not taking this into consideration. Patient coming, I'm having personal problem, offer confidentiality. I'm having personal problem, offer confidentiality. He's reluctant, offer more confidentiality. So this is the answer. If the patient say, doc, actually it is quite personal, I don't think so how to talk, so offer very good confidentiality. I can understand that, but I tell you that whatever will be talked will be remain between you and between our medical team. Nobody will be knowing about that. So I'm your doctor. You can talk anything you want to me. It will be kept confidential. Okay. So this is the way you can There are certain scenarios. One is the person, pregnant woman, she become pregnant. It's very much commonly coming. And the other one is this erectile. It's not that common coming, but you should know about this. This is not that. The other is the woman, very young age, get pregnant and offer confidentiality. And it here again offer confidentiality. Okay, the other one is, um, here is the history. The patient is actually, everything is all right. The patient is actually taking beta blockers. The patient is having heart disease and high BP, taking beta blockers. Nothing is other thing important. Ask about, take the history, since how long you having this problem. Then these are the specific questions you need to learn by heart, because if you are not learning these questions by heart, you are not going to ask. These are the questions. These are the questions of erectile dysfunction. How would you rate your desire for sex? How often do you get your erection? How often do you get erection hard enough to penetrate? How often are you able to maintain erection during sexual intercourse? How often are you with your sexual relationship? How satisfied you are with your, because sometimes no problem is there, the person is not satisfied with his partner. So you need to ask this question. And one question is early morning erection. This is skipped question because this is very much important. But the important person do not have early morning erection. Ask about. So learn. I know these kind of questions we are not used to ask. That's why you need to learn these kind of questions. Like you need to learn them. You need to memorize them, because we are not used to asking these questions to any patient. Then ask about the sexual orientation in here. Ask about the active partner. Ask about take the sexual history as well. Okay. But in this, the most important things are there, because everything you can ask. This is, we are reluctant. We are reluctant most of the time to these questions. Then ask about what are the DD in here, because you can ask about the BPH, depression, diabetes, medication. Ask about PMA, Holy Family, Desert IE is again very much important. How it's impacting your life. And depression is very much important. These patients can present with depression. There is a scenario, the patient comes with depression and he's having erectile dysfunction. There is a scenario. This is, I have seen that scenario as well. Okay. So you need to ask all of these questions. The person is having diabetes because, why diabetes? Because diabetic patient can have this problem as well. Ask about regular medication, SSRI, beta blocker. These are the two most common scenarios coming with the SSRI and beta blockers, these two. Okay, then examination and the PR examination and examination of the genitalia. What is the management from what you told me? It is secondary to, because taking medication is like that is contribute beta blocker. So if you have already prescribed the medication or the GP has already prescribed this medication, you can change. You can change to ACE inhibitor. But if you are not, you can like refer to the specialist who prescribed. This is the rule of thumb. Okay, because when you say, okay, I'm taking beta blocker, who prescribed this medication? It is the specialist who prescribes, it's the cardiologist. Okay, then refer to cardiologist over here. If you or the other GP, then you can change the medication to ACE inhibitor. Okay, then you will be sending for certain lipid profile and HbA1c to rule out the it's any cause, because atherosclerosis can be cause of this as well. Then we stop, you will stop beta blocker and change to other medication. Patient will say, can I use Viagra? You will say, yes, you can use. However, if you feel dizziness or lightheadedness, you should come back, because it can be dangerous sometime. And offer lifestyle modification, regular exercise, stress management, reduce alcohol consumption. In this scenario, this is quite important. Never forget this. Never forget this, because these are all contributing factors. Okay. And relationship, offer relationship therapy as well, because if say my relationship is getting worse because of this, offer relationship therapy. Offer leaflet as well. And this scenario, I think, is last scenario is a nosebleed. It is a nosebleed scenario. In clue for this scenario is that I read for you, FY2 in GP surgery. 40-year-old presented with some concern, had DVT 3 years ago, taking apixaban, talk to the patient, address his concern. In this patient, they want to check you whether you are templated or not. If you are not taken by that thing, this is past station. This is important as well. There are other stations like similar like this. They are checking certain approaches. In this, typically they are checking you are templated or not. Why? Because they have told you it is DVT and they have told you it is a Pixaban. And when you are going towards the management and you are not asking about having INR done, and he's not going to tell you anything, and you are saying because, and in the management you are going to tell because you are taking this medication, your notability is this, and you are failed. Why? Because this scenario is not, because in this INR is normal. In this scenario, when we'll be asking, the INR will be normal, and actually the patient is having some trauma in his bleed. That's why she's having the bleed. That's why this is a tricky scenario, because, for example, this scenario comes in front of you. You will say, okay, this I have got this scenario. I have got this scenario. This is, and these are the scenario which the persons come and say, I have done this every aspect. I covered all the aspects, but it's got failed. If you cannot tell the diagnosis in some scenario and you are telling the diagnosis, this is failed scenario, because they were there, that was supposed not to tell the diagnosis, and you are telling the diagnosis. For example, if the shortness of breath patient and you have asked a lot of questions and he has the long-term medical history, he has like TB, he's telling the TB. There is one scenario like this I have taught you, like you have asked a lot of questions, he's giving you the history of everything, and in the end you say you are having cancer. He will say, okay, you are failed. Then you are failed if you are telling the cancer, because you are not the magician to tell that it is the cancer. Okay, you need to use your approach. If it comes similar in this scenario, it is the case. For example, you are going to take the normal history of bleeding, when, how long, what type of bleeding and how much, everything. It's normal. Then you'll be asking about the trigger factor, any trauma. First thing to ask is the trauma. The other regular medication, he's telling you that I'm taking this medication, I'm having the DVT, that's already written in your form. So no problem with that. So after ruling out the DDs, any of these is not coming, nose picking, blowing, you're asking, he's saying binge drinking, ask about all of them. Then PMA, olifamily, desatoli, in that you'll be asking about the medication, any long-term medical condition, any desatoli, because the drinking a lot of alcohol also pose you at the threat of any other medication. He can be taking any other medication. He can be having an inherited disease. If you're not asking about the family history, then it is a disaster as well, because you need to ask about any of the family history regarding the bleeding, because the bleeding is very much common. It's an inherited disease. Okay. You have asked all of those questions. Nothing comes positive. You can say, okay, actually, but you have told me that as you are taking this medication, however we did INR, it is normal. That means it is not actually the main cause of your bleeding. It could be like trauma or anything. I'm not clear about that. So we need to run a couple of more tests for that. You can say this. I need to involve the senior. You can say this, and you will be having 10 out of 12 marks. And you will be telling here, okay, this is because of you are having a Pixaban and you are fail. You are confirmed fail if you are telling, because you have taken exact history it needed to be taken, but in the end you got deceived because of that this station is failed. Then okay, the management is the nasal bleeding because due to the nasal picky, and you are on the blood thinner medication. You can tell it pose the risk. However your INR is normal, tell that. However your INR is normal, tell the examiner that I know this fact. Okay. Advice, avoid any nose picking, avoid strenuous exercise, over the counter medication. This is important to avoid in here. NSAID medication, offer septin cream, but then you can offer if you have asked about the allergy. If you have not asked about the allergy, don't offer this. Then better not to offer. If you are asked about the allergy, say no allergy, because it contains niacin, and niacin can contain anaphylactic reaction, so you cannot prescribe. If you have already asked about the allergy, then offer the niacin cream. Okay. What are the precautions you need to take? These are the precautions whenever there is a bleed. What you need to do, you can just read that you not the bony part, the other septal part, you need to like hold that for the 15 minutes, and if it's not getting, then you can come back to the emergency at once. This is all this scenario is about. anything you want to ask, because these are the quite important scenario we have talked about today. Anything you people want to ask, because our course is, though most of the people were not that serious, but the people are sitting over here, they've been the quite serious one. But I don't mind, because they have to read, they have to pay someone for this thing, if they have not done that regularly. But trust me, you will not have these kind of notes anywhere. The issue was not to teaching you, the issue was to preparing the notes. The issue, in the next session, it will be quite easy for us to teach, but in this section was like, really it was quite troublesome for us to teach, because there is no readily available notes in this format, because they all the academies know that if the notes are out, and we will be nowhere, we will be standing nowhere. Any question regarding the 2 day scenario, any person about to ask, because it's already quite long session today, and in the practice sessions we will be doing